Viruthasarani, Professor, Department of Community Health Nursing in SNS College of Nursing. My children are here to discuss about the case presentation on mother with anemia. Yes, let's discuss.
Anemia in pregnancy is a condition in which the pregnant woman have lack of haemoglobin in red blood cells, which causes adequate amount of oxygen supply to the mother and to the baby.
Yes. What are the types of anemia?
There are 3 types of anemia, ma'am. Iron deficiency anemia, vitamin B12 deficiency anemia, and folate deficiency anemia.
So, what are the causes and symptoms?
Causes are HIV, heavy blood loss during the menstruation, chronic diseases, parasitic infection, and their symptoms are fatigue, weakness, shortness of breath, pale skin, swelling, and edema.
Yeah, mainly dizziness and dyspnea. So, what is dyspnea? Difficulty in breathing, and some beneficiary they have loss of hair also. Okay. So, the main and foremost thing in case of beneficiary, the main causes of anemia is parasitic infection. That is the main cause. Okay. Yes. So, what are the let us be discussed symptoms and also causes for that. So, what is the diagnostic evaluation for anemia?
Diagnostic evaluation for anemia like history collection, physical examination. Physical examination we assess the conjunctiva, edema, and puffiness of face. In conjunctiva, the beneficiaries use the thumb finger, pull out the conjunctiva and above the eye. Then edema into non-pitting edema, pitting edema.
Okay, these are the clinical manifestation as signs and symptoms in case of anemia. Yes. So by doing that history collection and physical assessment, we can able to assess whether the beneficiary is having anemia or not. Okay. So while taking the history collection, now to ask about that diet whether they are consuming the food properly or not, whether they are having that fiber eating. So what is fiber eating?
Consuming non-nutritional substance like grape, sand, and pickles.
Yeah, frequent eating of pickle and chalk and mash powder that they are taking. So if the person is taking, you have to came to the conclusion like that person is having anemia. So you have to consult the physician and based on that you have to take a treatment. If the persons keep on taking pickle or other non-nutritional substances, definitely we can refer the person to see a doctor. Okay. And next, what are the treatment?
So the medical management for anemia with mother's include oral iron therapy, which is the first line treatment. Then folic acid, which can be given about 400 to 500 microgram per day. Then IV iron, that will include iron sucrose and iron dextrose, which is rarely used. And anemia, which is caused by parasitic infection, can be treated with an albendazole. And the vitamin B12, about 1000 microgram iron for 6 weeks, then in month. These are the medical management for anemia with mothers.
Okay. So what are the foods we can advise for the mother or if the person is having anemia? We have to advise them to take iron-rich foods. So what are the iron-rich foods are there?
Iron-rich foods are divided into heme iron and non-heme iron. Heme iron are animal products like red meat, bone marrow, liver, and spleen. Non-heme iron are all plant sources, all green colored vegetables, especially drumstick leaves and brinjal, turkey berry, dates, and jaggery.
Yes. Okay. For the parasitic infection, she told that administration of albendazole. We know about that doses of albendazole and when we are supposed to give that albendazole. Yes, doses of albendazole in case of adolescent and adult, we have to give 400 mg at night time with the full stomach. Okay. Advise the beneficiary to take albendazole if they are taking today night. Advise them to take another dose after 15th day. Why you have to take after 15th day? On the day, all the worms are evacuated to the feces, and the 15th day if you are taking means all the ova also evacuated through the feces. This is in case of of underfed children, they can't able to swallow the tablet. In that case, we can advise the mother or caretaker to give a albendazole syrup. When we supposed to start? We have to start at the age of 2 years only, not below the 2 years. Okay, it is very dangerous for the children. So advise the beneficiary or caretaker, we have to start albendazole. They are giving lot of complaints towards us. The children is not able to take food properly, and they are having in the night time they are telling about the channel itching. That is, they are telling the cardinal sign of worm infestation. What is the cardinal sign of worm infestation? How we can identify that? The person is having that pale mark, that is white spot on the cheek. Okay, if the cheek, any white spot on the cheek, it indicates they are having some worms in the gut. And they are having that anal itching, especially night time. The term is nocturnal anal itching. That is night time anal itching they are having. And one more thing, they don't want to take the food properly. They are having loss of appetite. And one more thing, protrude abdomen. The abdomen is projected outward. So these are the cardinals. And one more thing, worms present in the stool. If they are passing the stool, we can able to see that worms present in the stool. So these are the cardinal sign of worm infestation in case of underfed children. So for them we have to advise the syrup form. That is, the syrup is available in the 10 ml. So we have to advise the mother to give only 5 ml. 5 ml is equal to 200 mg. For in case of adult, they have to give 400 milligram. For the underfed children or under 10 years children, have to give 200 mg with the syrup form. For them also have to advise. So if they are taking today night, so advise the mother or caretaker again have to give a 15th day to kill all the overs present in the gut. Okay, so if they are giving only 5 ml, but the total capacity of that syrup bottle is 10 ml. So advise the mother to give only 5 ml and remaining medicine should be discarded. Okay, advise the mother, don't keep that medicine on the 15th day. Don't wait for the same syrup on the 15th day. So it is again poisonous for them. On the 15th day, again the mother have to buy new syrup. That is also 10 ml is available. So advise the mother to give only 5 ml. Again that should be discarded. Okay. So this is the method of giving albendazole in case of underfed children and also adult. Did anybody know about that worm infestation day? When we are celebrating World Worm Infestation Day. So biannually we are celebrating World Worm Infestation Day. August 1 to 7. What is the special in case of August 1 to 7? Yeah, we are celebrating World Breastfeeding Week 1 to 7. But 1 to 10 World Worm Infestation Day. And another one is 1 to 10 in case of February. So biannually we are celebrating World Worm Infestation Day. One is August and another one is February. 1 to 10, 1 to 2. Okay. Are you got it? Do you have any doubt? Okay. So that's all about the mother anemia. Okay. So you have to look specially worm infestation also. First you have to treat the worm infestation. Then only we can advise the mother to go with the iron-rich foods and other iron medications. Okay. Got it?
Yes, ma'am.